I have to admit, this is my passion. I love CLL. It's a very complicated, as you know, chronic B-cell malignancy with these really complex and kind of only partially understood immunosuppressive effects on patients' immune systems as a mechanism of escape and progression. And it's kind of a disorder, as I said in my oral presentation, of a few different diseases, right? There's the chronic proliferation, accumulation, organ replacement in the bone marrow, and sometimes in this, of course, the spleen and lymph nodes. But it also is this immunosuppressive disease with secondary cancers and infections and poor outcomes with CAR T-cell therapy. And you know, we've just had a recent FDA approval with liso-cel just this last year, and that's after over 10 years of research, basically. So it just shows you it's a unmet need. Patients with CLL, of course, have excellent overall survival, generally speaking, but there are those subsets of patients with high-risk disease, 15 to 20% in their lifetime will require multiple lines of therapy. And of course, we're looking eventually to get to cures for CLL. So our work was a study all at Roswell Park in Buffalo. Everything was homegrown, I'm proud to say. And all we did was we took 13 patients so far, with more to come, treated with standard of care Venetoclax-based therapy. And we looked at baseline in 30 days after treatment. And normally that would not be an oral presentation at ASH, but I think what we did was unique in that we looked at multi-omic analyses, so specifically transcriptomics by RNA sequencing. We looked at RRBS, which is a way to look at methylation. And then we looked at advanced flow cytometry panels as well to look at T-cell repertoires and other immune cell repertoires that we use from our allogeneic stem cell transplant program and cell therapy program. We also looked at metabolomics as well. So Dr. Spencer Rosario at Roswell and Dr. Dae-Kyun Kim are kind of panomics experts. Jacob Wright, I want to say, is a fantastic young student looking for his PhD, did a lot of the work. And Dr. Hernandez, of course, has, and soon-to-be Dr. Mandeville and Corey Mavis in our lab, fantastic contributors. They'd been doing work for several years looking into Venetoclax. And Dr. Mandeville's, soon-to-be Dr. Mandeville's presentation was also presented as an oral abstract to this ASH in the in vitro setting with diffuse large B-cell lymphoma cell lines. Interestingly, we have a lot of overlap, actually. So despite being completely different disease states, but with the same drug, we showed that there's significant T-cell repair, and in CLL, significant immune, and this is in vivo data or ex vivo data, we showed there's significant repair of multiple compartments of the immune system in this multi-omic model. Spencer Rosario was able to overlay and match RNA sequencing data with the metabolomic data in these pathway maps that I'm sure confused everyone at our meeting. But long story short, multiple on switches were activated and showed improved stemness of T cells that can usually confer greater and better outcomes with CAR T-cell therapy and in other immunotherapies. We also built CAR T-cells out of patients' isolated T-cells at day 0 and at day 30, and we showed improved cytotoxicity in the majority of patients, at least at a couple effector target ratios. And so we think this really could be a pioneering new approach that Venetoclax repairs the immune system. We dove in a very detailed multi-omic way on just 13 patients, but very deeply, and much more food for thought and research, and hopefully some interventional trial opportunities to help patients to get better faster with less toxicity.